Assalamu alaikum, guys. Today I'm going to be giving a review lecture. This quick, a quick review. It's not going to be too long, and we're going to be reviewing the blood vessel histology. Okay, so blood vessel histology, in my opinion, is actually pretty easy if you just understand the core concepts. And we're going to be describing the arteries and the veins today. Okay, so I'm going to be using the doctor slides. I did add some slides in there too, but I'm also going to be using the doctor slide, Dr. Annie's slides. So here, this is just going, this here, these three slides here, they're not very important, okay? They're basically just telling you microscopy principles, okay? So this is nothing important as well. This here is it's not very important like for the lecture today. It's just telling you how like endo would mean inside. For example, endothelium, right? Endothelium would mean the simple squamous epithelium that is inside, or peri would mean outside, right? Around, excuse me, around. Macro would mean large, micro would be small. This is just like prefixes and suffixes used to describe things, okay? This is again, you don't have to know these, but these will help you like, identify where structures are or the location of the structures just based on their names, okay? So again, this is also another core principle. These are skeletal muscles actually. You can see the striations and the peripheral nucleus. Again, this is a longitudinal section. There's a cross section. Cross sections, as you can see, it kind of like a polygonal structure. Okay, and again, we're not even talking about skeletal muscles today. We're going to be talking about smooth muscles mostly. Okay, so this is another principle. Okay, basically how some epitheliums could be named after their location. For example, transitional epithelium could be named after its location, right? It's called urothelium because where it's located in a urinary system. Okay, and then other things, however, it's like a name, right? You can't really name them from their location. For example, Purkinje fibers. We don't name Purkinje fibers from like because where they're located at the heart. No, they just have their own names. So yeah, these unfortunately you just have to memorize. While the other ones you can slightly, figure out where they are just based off their names. So this is just again, this is really basic overview, okay? So basically, aorta will branch off into smaller arteries. This is the branchy thing, where it will branch off into smaller and smaller arteries until it reaches the capillaries, okay? And then the mergy is where the capillaries, right, will go into venules, then venules will merge until it goes into superior and inferior vena cava, which will go into the right atrium, okay? So again, arteries, very easy, right? Um, Remember, arteries, they all start at the left ventricle, okay? Left ventricle, go to the aorta, then to the arteries. There's four different types of arteries we're going to be talking about today. Um, and then to the capillaries, where gas exchange and nutrient exchange occurs. And yeah, that's it. Remember, capillaries are not arteries, and they're not veins too. They're not arteries or veins. They're a completely different type of blood vessel. Okay? Yeah, exactly. These become branch, and they become smaller. Okay. Now here we have so these are the capillaries. Okay, so the capillaries is kind of like a U-turn. Okay, and this capillaries, all you have to know about capillaries is that there's infinite, like not infinite, excuse me. There's a large amount of capillaries, zillions, as you can see here. That's not an actual number, but there's just to signify that there's many capillaries. You can't really count them. They're very small too. And the capillaries, the most distinct feature about the capillaries, there's actually a feature, like structural feature, is that they only have the tunica intima. We're going to talk about the layers in a bit, but tunica intima, right? Arteries contain three different layers: tunica intima, tunica media, and tunica externa. The capillaries will only have tunica intima, which is just a single squamous epithelium called endothelium. Okay? Yeah, exactly. Capillaries are not they're not veins or arteries. They're basically just their own thing. Okay? Okay, let's get to it here. Okay, now veins, kind of the same thing. One thing about arteries. Now veins, you know how arteries will carry blood away from the heart, veins will carry blood to the heart. This is all basic stuff, okay? All the veins from the capillaries, venules, the veins will merge into the five different types of veins, okay? And then after merging, they will go and all basically join the superior vena cava and the inferior vena cava. And also, there's one more that isn't included here. It's called the coronary sinus. The coronary sinus will be kind of like the combination of the veins in the heart, okay? So yeah, all the veins in the heart from the coronary sinus, right? They will come at the coronary sinus. But it's not written here, so you just have to know that just in general though. Like the veins in the heart, they empty from the coronary sinus, okay? Yeah. So now this is a lymphatic system. We learned a lot about lymphatic system in in the FND. So I'm just going to give you a quick review overview. So the lymphatic system has lymphatic capillaries. The lymphatic capillaries will merge into lymphatic vessels, and then lymphatic vessels will go into thoracic ducts, lymphatic ducts. There's two lymphatic ducts, the thoracic duct and the right lymphatic duct. The thoracic duct will empty into the left subclavian, the junction between the left internal jugular vein and the left subclavian vein. And the right um, lymphatic duct will empty into the right internal jugular vein and the left subclavian junction. Okay? Um, it has three tunics as well, and it has valves like veins. Okay, it has valves and three tunics. But remember one thing that the tunics are actually thinner, they're thinner than in veins. Okay, so the tunics in the lymphatic system are the thinnest because the tunics in the tunics in the arteries are the largest, are the thickest, while the tunics in the veins and then the tunics in the lymphatic vessels are going to be the thinnest. Okay, so yeah, that's about it. Now this is again not very important. We're gonna get to the important stuff in a bit, but this is saying that the veins, the arteries, and the nerves, they all lie parallel to each other, okay? They're lying parallel to each other. You see this here? They're lying parallel to each other. And they're also next to each other, right? Lie parallel and they're next to each other. Obviously, the arteries and the veins will carry blood in opposite directions, arteries away from the heart, veins to the heart. And obviously, arteries will carry the blood away from the heart to the capillaries where blood exchange will happen, right? And then, exactly, veins will carry the blood to the right atrium. Um, And yeah, at the capillary beds, remember, like arteries, they come in, okay? And then the capillaries kind of connect the arteries and the veins, okay? So arterioles, then capillaries, and then venules, and then veins, and then arteries, okay? It's kind of a U-turn where arteries become veins, okay? Now, sometimes the name of the artery and the nerve and the vein can just be based off its location. Sometimes it has a unique name. For example, the artery in the femur is called femoral artery. The artery in the vein is called femoral vein, and the artery in the nerve is called femoral nerve. Okay? And lymphatic vessels don't really have names. They're just the lymphatic vessels of the vein or whatever. Excuse me, lymphatic vessels of the arm or whatever. Not really important there. This is just a microscopic view of the veins. And here you can kind of see the three layers, right? Tunica intima, tunica media, and then tunica externa. Okay, we're going to talk about them more in detail on that though. Okay, this is pretty important, but not that important. So basically what this here is saying is that arteries, they will have very high pressure. Okay, arteries will have the highest pressure, and as you go from the aorta to the smaller arteries, the pressure will actually decrease. Okay, the pressure will become less and less and less. When it reaches the capillaries, the pressure becomes very low. Okay, so and the blood flow in the capillaries is actually very, very little. And the reason why the blood flow in the capillaries is very little, like here, pulsing stops at the capillaries, right? The capillaries, they have no tunica media. Okay, they have no smooth muscles. So the pulse, it stops in the capillaries, and the blood flow in the capillaries is really slow. And this is important for one thing, and this thing is for efficient gas, like efficient exchange of gas and nutrients. If that weren't happening, like if the blood was moving too fast in the capillaries, firstly the capillaries would probably burst, and secondly, not only would they burst, but the gas exchange won't be efficient, right? There won't be efficient gas exchange and nutrient exchange. Now, as you can see, this is a very cool graph where you can see from the aorta to the elastic arteries, the muscular arteries, as you go down, 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 the pressure decreases and decreases and decreases. And even you might expect the pressure to increase after it goes from the capillaries to the venules. No, the pressure from the capillaries is actually higher. And once we reach the right atrium, the superior and inferior vena cava, the pressure actually reaches zero. You can see there, pressure reaches zero. So the pressure increases as you go from the aorta to the elastic arteries, to the middle, to the medium arteries, to the small arteries, arterioles, capillaries, venules. The pressure will decrease. Okay. Now we're gonna go to the important stuff. So now I need your focus. That all was kind of like a review. Okay. So I'm just going to explain it real quick here. There's four different types of arteries, right? We go from the aorta to the arteries. When we say arteries, we're going to classify arteries into four different types, okay? These four different types are large elastic artery, medium muscular arteries, small muscular arteries, and arterioles, okay? And they can be identified based on two things: the fenestrated elastic lamina and the smooth muscle layers. What do we mean by fenestrated elastic lamina and smooth muscle layers? I'm going to explain to you right now. Remember, veins are similar, but they will have thinner. And I actually have a graph explaining all the veins things, so we're going to get to that later. So here, before we get to this, I'm just going to explain each layer of the tunics, right? The tunica intima, tunica media, and the tunica externa. So firstly, the tunica interna or intima function is what? What is its function? It's a single squamous epithelium, so it allows for diffusion, okay? It allows for the diffusion of nutrients and things like that, okay? Obviously, the lumen, what would the lumen contain? Blood, okay? Um, Remember, what is the tunica intima consisting of? The endothelium and its basement membrane. And remember, what is always under endothelium or like epithelium in general? Always under epithelium is going to be loose connective tissue, okay? Loose connective tissue. So subendothelial. Subendothelium means below the endothelium, you would have what? Collagen, fibroblast, basically loose connective tissue, okay? Fibroblast, collagen, ground substance, okay? Next, we go to the tunica media, sorry, tunica media. So the tunica media is the part where it contains the smooth muscles. Okay, it's the part that contains the smooth muscles, and its function usually is for vasoconstriction and vasodilation, right? It contracts and pushes the blood forward. We're going to talk about it more in details in all the different types of arteries, but that's basically just like a overview for you. Its function mainly for, to push the blood. Okay. Now, the tissues in the concentric layers around the lumen, we have smooth muscles, okay, smooth muscle layers. Then we have fenestrated elastic lamina layers, and we have collagen fibers. I'm going to explain to you more in detail when we look at the images, but just keep that in mind. I'm going to show you the elastic lamina because when I first saw these, I was kind of confused as well, but then I understood them. So the cells, remember, this is a very important point, okay? The cells in the tunica media, they do not, the tunica media does not have fibroblasts. But then you might be confused because if it doesn't have fibroblasts, then how does it have elastic lamina layers and collagen fibers, right? These are byproducts or like synthesized and produced by the fibroblasts. There's something very interesting in the tunica media where actually the vascular smooth muscles, the smooth muscles in the tunica media will actually produce collagen and elastin, right? They will synthesize collagen and elastin. Usually, the fibroblasts make the collagen and elastin, right? We know this. And what it does, obviously, also it contracts and pushes blood forward. You know that, right? Because it's a muscle. Vasoconstriction, vasodilation, it contracts and pushes the blood forwards. The last layer we have is the tunica externa. And the tunica externa is just going to be, I like to just call it like the connective tissue layer. It's just going to contain connective tissue and loose connective tissue to be more specific, fibroblast, collagen, ground substance, which are all basically just loose connective tissues. Okay. Now there's important functions of it. It connects to the rest of the body. What do we mean by connects to the rest of the body? So basically, how the vessel, like it has the tunica interna, tunica media, and then the tunica externa. The tunica externa is going to be the outer part which connects it to the rest of the body. Okay. And it also prevents overexpansion during systole. During systole, right, the arteries and the veins, they have elastic fibers, so they stretch. It prevents it from overstretching. And this could also be preventing it from bursting, okay? So it prevents the arteries from bursting, okay? It prevents the overexpansion during systole. During systole, the artery expands because to accommodate for that higher pressure it prevents. Now, presence of vasa vasorum. So when I saw this, when studying the slides, I was also a little bit confused what vasa vasorum knows. Now, I don't know if Dr. Annie expects you to know it, but I just here put this slide here just to kind of explain it to you guys. So vasa vasorum are the tiny blood vessels that supply the walls of the arteries and veins with oxygen and nutrients. So you know how we talked about, the tunica intima, tunica externa, tunica and intima, externa, and media? Oh, wait. Yes. So basically, these they need the tunica externa. It needs a blood supply. Otherwise, it won't be able. Like every cell in the body needs a blood supply. Okay, every cell in the body needs a blood supply. So the tunica externa receives that blood supplies from things called vasa vasorum. Now I don't know if you need you probably don't need to know the different types of vasa vasorum. All you need to know is that vasa vasorum are just tiny blood vessels that are in the tunica externa that basically supply the cells of the tunica externa. Okay, that's all you need to know. Obviously, the vasa vasorum, which is you see this extension here from the artery itself. This is the vasa vasorum. Okay, it's an extension from the artery. Okay, it could be an extension from another artery coming into the tunica externa, but it can be anything. And then obviously, right, it needs not only an arterial supply, it needs also a venous supply. Okay, where to collect obviously the venous and the arteries are all connected. Okay, so very important here. Actually, I don't know if it's very important, but just keep it in mind because she mentions it in this slide, presence of vasa vasorum. Where is the vasa vasorum? It's in the tunica externa. That supply the cells of the tunica externa. Here we're just showing you the smooth muscle cells, and as you can see, they're fusiform. Okay, this is an arterial. We'll talk about it in a bit later, but this is the electron microscope image. As you can see that the cells are fusiform here. Okay. Okay, so this one here is the major elastic arteries, okay? So this is the major elastic arteries. Their functional name is called conducting artery. And now we're gonna go back to here real quick, okay? So how much fenestrated elastic lamina? Many. What is the smooth muscle layers? 30 to 40. Let's see what it means by that. So look at this. If we zoom in here, we're going to see, look at this. You see these black things, like this black line here, this black like thorn-like line. This line is the elastic fibers. Okay, these are the elastic fibers. What we mean by elastic lamina, fenestrated elastic lamina, is the layers of elastic fibers. So here we have one, two, three, four, five, six. It's a lot, okay? It's about 40 to 70. You don't have to memorize exactly 40 to 70, just keep it in the back of your mind. But just know that it has many fenestrated elastic lamella, okay? Many. And then another identification is look at the amount of smooth muscle layers. Obviously, this image is like very, low magnified. And here you can see it's very too high magnified, but you're going to see about 30 to 40 smooth muscle layers. And this is, yeah. Now, elastic fibers don't usually attain this black stained during actual in a like H&E stain. You have to actually use a specific stain, which you don't have to know, but you have to use a specific stain to make them appear this dark, okay? But in a H&E stain, you can see them. It's just a little bit harder, okay? Now, the tunica intima, what we're looking okay, wait, example of this obviously is the aorta. We learned this in F&D, the OSPE, right? And identification, what is identification? Has many fenestrated elastic lamina, and it has 20 to 30 smooth muscle layers, okay? Now, um, let's look at the intima. Firstly, the intima, here's a general rule, okay? The intima and the externa will be constant to all of these different types of arteries, okay? It will be the same for all of these arteries. So basically, right, 30 to 40, okay, smooth muscles. The collagen, there will be collagen, obviously. So let's go to the tunica intima first. The tunica intima, what is going to be the same? Endothelium, okay, endothelium, basement membrane, loose connective tissue, okay? That's it. Subendothelial connective tissue. Now, the tunica media is going to be different in every single type of artery. Okay, it's going to be different in every single one. Right? The ones that we're going to talk about is going to be different in every single one. For this one, the tunica media will contain about 30 to 40 smooth muscle layers. It will contain about 40 to 70 um, these layers of elastic lamella, excuse me, and it will contain collagen. All of them will contain collagen, okay? But remember, it will contain collagen, but there is no fibroblasts, right? There's no fibroblasts in the tunica media. The smooth muscles will actually produce that fibroblasts and elastic fibers, okay? Next is the tunica adventita, and the tunica adventita will also be the same. It will contain, again, loose connective tissue and also macrophages. In the loose connective tissue, we have resident cells macrophages. They're called adventital macrophages. You don't have to know that, but yeah. Um, they also have a neurovascular bundle. What do we mean by neurovascular bundle? So it's in the name, right? Neurovascular. That means so it's a basically kind of like a fancy way to say nerve supply and vascular supply. So the vascular supply, just as we talked about, is the vasa vasorum. The the small vessels that are in the tunica externa supplying the cells of the tunica externa. Okay? And then we also have a nerve supply, nervi vasorum. So this nervi vasorum is only going to be sympathetic neurons. This is very important that the the blood vessels are not innervated by parasympathetic nerves, okay? They're only innervated by sympathetic nerves. And you might be like, oh, wait, then what causes vasodilation, vasoconstriction? It depends on the adrenergic receptors. Alpha, this is not that important. You know, you don't have to know this for now, but I'm just giving you for your information. Alpha 1 will vasoconstriction, while beta 2 will cause vasodilation, okay? Binding of norepinephrine to, or just epinephrine or epinephrine, epinephrine to alpha 1, will, alpha 1 adrenergic receptors will cause vasoconstriction, and beta 2 will cause vasodilation, okay? Now the function, obviously, it has many elastic fibers, so so it's very elastic, okay? So what do we mean by very elastic? What we mean by very elastic means it can stretch and recoil, okay? Very well. So what do we mean by stretch and recoil? We mean that it can stretch and then return back to its original shape um, without, without permanent change in its shape. It's very elastic, okay? Location close to the heart, obviously. Then the number of large elastic vessels is very few, okay? There's only a very couple. Example is like left common carotid, common iliac, subclavian, all the veins that are arteries that you can kind of like see almost microscopically. Now, the accompanying veins, what do we mean by accompanying veins? I'm going to go into detail more about what accompanying veins mean, but the accompanying veins is superior vena cava and inferior vena cava. We're going to get into that more though, don't worry. So next we have the middle size artery. So the middle size artery, also what is its functional name? Distributing artery. Now, why is its functional name distributing artery? It's because it distributes from the large elastic veins. They branch off into middle muscular veins and distributed to different parts of the body. So we're called distributing arteries. That's our functional name. So what is an example? Ulnar artery, right? And the identification, look at this, okay? They use the stain here again. The stain is, you don't have to know the stain, but they use a stain which very clearly shows the elastic lamina, okay? So here's the first one. This is the internal elastic lamina, and this is the external elastic lamina. Now, what is the difference between internal? The internal is going to be the elastic lamina that is between the endothelium and the tunica media, or excuse me, is going to be between the tunica intima and the tunica media. Okay, and the external elastic lamella will be the elastic lamella layer that is between the tunica media and the tunica adventita. This is tunica adventita here. So this one right here, this will be between the intima, which is this, and the media. And then this one, which is going to called external elastic lamella, right? It's remember that the large elastic arteries, they also have an external and an internal elastic lamella. We just don't label them because they have multiple layers of elastic lamella. So these ones only have two, as you can see, two layers, one in internal and one that is external. The internal one is going to be between the tunica intima, which is the inner layer, and the external one is going to intima and tunica media. And the external one is going to be the tunica between the tunica media and the tunica externa. Okay? Smooth muscles is going to be about 20. Okay? Obviously, the best way to classify these is from the external lamellas. The smooth muscles, it's kind of hard to count the amount of layers, okay? Tunica intima will be the same in all of them, so what will it contain? Endothelium and basement membrane and loose connective tissue, okay? The external also the same. It will contain a neurovascular bundle as well. What is its function? Again, you can see its function by its name, distributing. So it's going to branch and distribute blood. Exactly. Further away from the heart, what is its number? Remember, branchy, what? Their number is increasing, okay? And they're becoming smaller. They're smaller than the large elastic arteries. Yes. And the accompanying vein to the ulnar artery is going to be the ulnar vein. We're going to talk about what accompanying means in a bit. I'm going to leave that for later now. So now we have the next type of artery, which is type 3. Okay. So the type 3 artery is going to be, okay, we have small distributing artery. And So small muscular artery, okay? The functional name is small distributing artery. Example is digital arteries, which is arteries in the fingers, right? Now, identification. Now, look, here they don't actually use a special stain, but you see this black line right here? I want you to see this line right here. You see this? I'm tracing with the red pen here. You see that line? This line, okay? This is the internal elastic lamella. Now, this one, the small muscular artery, will only contain one layer of elastic lamella. Okay, fenestrated, they only contain one layer of fenestrated elastic lamella, and it will be internal. So they have no external, as you can see, this is smooth muscle layer, and this is the tunica adventita. Okay, it will have no, right? It will have no, as you can see, there's no external elastic lamella. There's only an internal elastic lamella. Okay? Branches and even more branches and many and digital veins. Exactly. So these are all same thing. Okay, remember tunica intima and tunica externa the same. Only thing that's going to be different is the tunica media. Now, last arterial. After this, we're basically kind of done. Last artery is the arterial. Okay. So the arterial, there's some things that are very important about it. Okay. It is the smallest one. Okay. Obviously, the smallest one. Now look at this arterial here. Look at these are this is the endothelial cells, and the endothelial cells they kind of like protrude out into the lumen. As you can see, they're kind of protruding out into the lumen. This is the lumen, and they're kind of protruding out into the lumen. Okay, and you see this here, this nucleus right here. This is actually a smooth muscle. Okay, this here is a smooth muscle. So it contains one to two. You might sometimes see another one here, and that would be two, but most of the time you're actually just going to see one, and it's going to be directly around the lumen. Obviously, what you can see the basement membrane here, it's right beneath the endothelium, and that's about it, right? Okay, so this is the electron microscope view here, and you can see here these are the endothelium. They're protruding into the lumen, and these nucleus that are around are the smooth muscles. And you're also going to see a very thin tunica externa, right? This here, right here, you see this? This tunica externa here. It's very thin, and you can't even like really see it in the light microscope. Okay, let's move on to the next one here. So this is just again the structure, right? So intima, right? Single endothelium and right again basement membrane with loose connective tissue, always the same. Now there is one thing, okay, about the tunica media, right? There is no more elastic lamella, okay? There is no more elastic lamella. In this one, there is no elastic lamella. You will not see elastic lamella. This dark line here is actually again, the basement membrane, right? So yeah, and also there will be about one to two smooth muscle layers, as you can see. Most of the time, you're gonna see one right here. You see one, right? You see one right there. One only. There's only one smooth muscle right there. So that's one smooth muscle layer. Okay. Tunica externa is very thin layer. Okay, it's a very thin layer of connective tissue, collagen to be more specific. Okay. Now, what is the function of these arterioles? These arterioles, they contain smooth muscles, right? They can vasoconstrict and vasodilate. So when they vasoconstrict and vasodilate, they can actually control the pressure of the systemic art, like of the they can control the mean arterial pressure, okay, the arterial blood pressure, and they can also change the blood flow to the capillaries. So when they vasoconstrict, they can actually decrease the blood flow to the capillaries and increase the arterial blood pressure. And when they vasodilate, they can increase the blood flow to the capillaries, right? Supplying more flow to the capillaries, and they can actually decrease the blood pressure in the arterial, so in the arterial blood pressure. Okay, the location, they're very far away from the heart. They're found in almost all tissue slides because remember, most tissues will have to have blood supply. When there's blood supply, you'll see arterioles. Okay, and the most important part that you'll find them is in the tunica externa. Why will you find them in the tunica externa? Because as we go back, the tunica externa of the large vessels, right? What does it contain? The tunica externa, it contains, wait, let me go back here. Look, it contains a blood supply. It's called vasa viscerum. Okay, it contains a blood supply called vasa viscerum. So you would find the endotheliums, these arterioles in the tunica externa because they're supplying the tunica externa cells. Okay, so that's why you'd find them there. Okay, you'd find them in the tunica externa. Okay, tunica externa of the other arteries we were talking about. Okay, because they're supplying, right? Because they're supplying the cells in the tunica externa. So yeah. Obviously not directly them, but arterioles will lead to capillaries, which then capillaries will supply the cells. Okay. So again, we talked about this. Obviously, the analogous vein is going to be the muscular venule. We're going to talk about that right now. Okay, so this here is a very cool slide because you can actually see all the different types of arteries. Obviously, this large one here, right? This large one here is going to be the large muscular artery, right? This one here is gonna it might actually be a vein because it's kind of collapsed. We're going to talk about that again. But this one looks like an artery here. And then this one here is a small, as a mid, as a small vein, right? A small artery, excuse me, small artery. And if you zoom in into the tunica externa, you'll actually see what arterioles. Okay, if you zoom in here to the tunica externa, you're going to see arterioles. Okay, let's move on. Now this is also pretty. I added this here because it kind of wasn't like clear. Like, what does corkscrew mean? So this is what a corkscrew is, and we're talking about the spring side of the corkscrew. Okay, so as you can see, the spring side of the corkscrew, it kind of goes like a round. And look, I added another clear image here. It's more clear than this one in my opinion. And you can see actually like it looks like a corkscrew. Look, it looks like a corkscrew. And this is when the smooth muscle is contracting. Compared to when the smooth muscle is relaxed, it has its normal fusiform shape. When the smooth muscle is contracted, however, I'll use this one, it has like a corkscrew shape. Look, it's going like this. Okay, this is when you can tell a difference between a smooth muscle contraction, and this is why we call it corkscrew nucleus of smooth muscle contraction. And this is a sign of what? This is a sign of vasoconstriction. Okay. This is again just a whole review of everything else. So I'm just gonna skip this one. This is also just kind of like a teaser for the next lesson. It's basically on capillaries, and that's why they're leaky. Capillaries, remember, they have one tunic. Okay, they only have one tunic, which means and the tunic is going to be the tunica intima, so they're going to only have a single endothelium layer. Okay, so let's continue here. So this is the veins, and there's 5 different types of veins: postcapillary veins, muscular veins, small veins, medium-sized veins, and the large veins, the superior vena cava, inferior vena cava. Now the postcapillary veins are the veins that actually they're kind of like capillaries, right? They only have one tunic. Then after muscular veins and all of them, they all have their regular 3 tunics. Muscular veins are actually just muscular venules, excuse me. This is called postcapillary venules, not veins, excuse me. So venules, not veins. These ones, what after this one, these are the normal venules, right? They have 3 tunics. Now this one here is what I mean by accompanying artery and accompanying vein. So what do we mean by accompanying artery and accompanying vein? So let's give you an example. So let's start like a medium-sized muscular artery. So a medium-sized muscular artery example is the ulnar artery, right? The artery in the forearm. So that brings blood away from the heart to the arm. What is going to be the accompanying vein that's going to be right next to it? The accompanying vein that's going to be right next to the ulnar artery is going to be the ulnar vein that's bringing deoxygenated blood back to the heart. Okay, let's give another example. Large veins, large elastic artery. The large veins, the aorta will bring blood away from the heart, excuse me, away from the heart to the body, while the superior and the inferior vena cava will bring blood, excuse me, blood from the body to the heart. Okay, so it's basically opposites. They're doing the opposite thing, and they usually lie parallel and next to each other, right? So you can use the arteries to identify the veins, right? Okay. This is just saying that the veins have valves preventing backflow because remember the pressure in the veins is very, very low. So because the pressure is very low, it can cause backflow. So they have these valves which prevents this backflow. Okay. Um, Also, remember these valves are also avascular. They don't have a blood supply, which means that they're actually supplied by the blood that's flowing in them, right? That's flowing in the veins. So this is actually a very, very nice image because it has the small artery here and then the corresponding small vein. So this is very, very cool. So the small artery, obviously, we know that it contains one fenestrated elastic lamina, and you can see it. It's very hard to see here though, but if you zoom in more, you see this like black line here. That is the elastic lamina, okay? That is the elastic lamina. And then here in the veins, look at this vein. It's actually oval shaped. Isn't that weird? It's oval shaped. And the reason that it's oval shaped while arteries will remain circular shaped under a microscope and with H&E stain is because veins, they collapse. And this is because their smooth muscle layer is much more thin. Okay, this contains like about 10. This will contain about 3 to 2 even. And this is a small vein, right? So it's very important to know that also the tunica adventita in veins is always thicker than the tunica media. Look, this is the tunica adventita, and this is the tunica media. Which one's thicker? The tunica adventita. So this is also another way to classify veins, right? Their ovular structure because they're collapsed, because they have a more thin, smooth muscle layer, and their tunica adventita being thicker than their tunica intima. Okay? Yeah. So this all says the same thing here. Okay. So this is we're almost like ending the lecture here. But these are venules and these are arterioles. How can you tell the difference between them? Well, first thing that I like to do is that venules, firstly, they both contain single squamous epithelium and usually one to two smooth muscle layers. Okay, that's universal for both. Now, the most difference that you can see actually is the flattened nuclei in the ven. You see these flattened nuclei in the venules here? Do you see them? They're very flattened. Okay. While in the arterioles, you can see that the nuclei are actually protrude. This is a lumen, right? This is a lumen. The arterioles are actually protruding into the lumen, right? They're not flattened. While in the venules, they're flattened, okay? They're flattened. Now, another identification is that the arterioles are usually perfectly circular, perfectly, but they're usually circular, while the venules are usually what? They're usually oval shaped. And you can see this more clearly in other slides, but this one is not that clear that it's oval shaped, but you can see this more clearly that they're actually oval shaped. But I like to use the flat nuclei. If you see nuclei protruding into the lumen and you see a single layer, it's going to be an arterial. Okay. Yeah. So next slide. Yeah. Okay. So now this is basically the last slide here, and this is basically showing you like a large elastic vein, okay? A large elastic vein. And look, you can see this large elastic vein, okay? This elastic vein, it contains external lamina. It contains a smooth muscle layer. It contains everything that the large elastic artery will have. But the only difference will be that the tunica media will be smaller and the tunica adventita will be like more thicker than the tunica media, and the amount of smooth muscle layers will be less, and there will be less um, fenestrated elastic lamella. Okay, and the most distinct thing, if you look at it in an overview, if we go back to like here, like the aorta or anything else in the arteries, look, they're all circular. They're luminous circular. If you see the like here, look, this is where is this slide? This one right here. Look, it's circular. It's not collapsed or anything. While this one's the superior vena cava actually, it's flattened, okay? And this is because of its thin, smooth muscle layer, okay? Yeah, so this is superior tunica intima, same, okay? The tunica media is very thin. It contains fewer smooth muscle layers, and the tunica externa is going to be the thickest in the veins, okay? In the veins only. And the tunica media is going to be thicker in the arteries, okay? Thin longitudinal section appears circles. Okay, exactly. So that's about it. I think we're done over here. So this is just a quick table that's not in the slides, but you can like use it if you want. It's basically just showing you like yeah, the large elastic artery. Now look, the large vein actually contains less smooth muscle layers, and it also contains less external and internal elastic lamella. They're actually rare or absent sometimes. Okay. While the medium veins as well, they contain about 1 to 5, and they have a certain internal and external elastic lamella, excuse me, but they're usually more absent. And the small venules and the small veins, if we go back, look, here she says the tunica externa, tunica media is thin, tunica externa is thick, and look, the tunica intima, it sometimes, right? It sometimes contains an internal elastic lamella, but most of the time it will not. Okay, so as you can see, small veins in venules, right? Internal elastic lamina absent, but it is rare in small veins. You can see it in small veins, but it's very, very rare. Okay? So that's about it. Everything else down here is summary, and we've already explained it. So also it's kind of like review from FND, like how the smooth muscles fusiform, blah, 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 and their gap junctions and everything intercalated this, if you forgot any of those. These are all summary slides that actually are very helpful, and you should give them a read at least. Okay? So that is the end of my review. Hope you guys learned anything from it. Um, Good luck with your studies. Okay?